Jakarta Governor Anies Baswedan asked the Indonesia's health ministry to allow asylum seekers and refugees living in Jakarta to get vaccination through the government national vaccination program. This request is part of the Jakarta government efforts to vaccinate people aged 12 and above, about 12 million population. Indonesia is targeting 208 million of its population must get at least first vaccine dose by the end of this year. However, about 13,500 asylum seekers and refugees are currently staying across Indonesia, mostly in Jakarta and surrounding. At least 10,000 of them should be vaccinated according to the UNHCR office in Indonesia. The Jakarta administration says in its official letter to the health ministry, asylum seekers and refugees who are in the list of people of concern must be granted free vaccines as they are not able to access the injection through the Gotong Royong vaccine scheme. Asylum seekers and refugees in Indonesia are not allowed to work and they have limited access to education. The situation is part of the Jakarta government consideration in its letter to the health ministry this week. Indonesia has not signed a refugee convention in 1951 and related protocols, but due to human rights grounds, the country has been hosting asylum seekers and refugees as a transit country since the 1970s.
Well, the Indonesian government has been conducting its national vaccination program, aiming to create herd immunity against the novel coronavirus 2019. Now, the government accelerates the program and expects to immunize 2 million people per day in August. However, not all people who are living in Indonesia can easily gain access for the vaccination. Among them are asylum seekers and refugees who are in transit in Indonesia waiting for possible resettlement in a new country.
And to know further about this particular issue, joining us today on Asia Prime is Rizka Argadianti Rachmah, Chairperson of Suaka, an Indonesian civil society group that's working on defending refugee rights. Good evening, Mbak Rizka. Thank you for joining us here on Asia Prime.
Good evening. Thank you for having me.
Mbak Rizka, before we start tonight's discussion, perhaps you can paint a picture for our viewers who are still unaware. What is the refugee situation here in Indonesia today? How many refugees are we hosting? In which areas or in which region of the country are they located? And which country does the majority of these refugees come from?
So we are currently having refugees for almost 14,000 in Indonesia. We are staying in Indonesia as a transit country, Indonesia as a transit country. And they are not only in Jakarta and surrounding areas, but also in other cities. And mostly they are coming from Afghanistan, half more percent coming from Afghanistan, coming from the conflict, we say so. And also they are living in a position where we already said they cannot go to work, they cannot make their own food on the table. But the current situation also affected to refugees, children who come into Indonesia. Like if you can imagine, if there are 7 coming to Indonesia and they're still stayed here until 8 years later, and it happened, so that means that 8 years education period they just wasted. In Indonesia they can have the education, but sadly it's not going into the system. So their education is not really acknowledged if they are resettled to the third country. And also they have healthcare system. The access is there actually, but if you don't have money, it's kind of difficult to get the treatment. And yeah, refugee cannot work. There are limited access to their rights. So doubling with this condition of pandemic, their condition is getting worse.
Right. Now, as we saw just now, Jakarta's governor sent a letter to the health ministry on vaccination, urging them to vaccinate refugees who are living in Jakarta. Now, do you think it was a bit strange that he had to do this, Or should there have been more initiative to vaccinate refugees? Because obviously vaccination is very important right now.
Sure, I agree with you. And Suaka really appreciates actually the effort by the government by making sure that in his authority, anyone can get vaccine. Surely this virus didn't recognize us based on our skin color, right, or our nationality. It could affect all people. So we also appreciate Ministry of Health that they are doing it based on science and run it based on the authority of making sure all people in Indonesia territory is healthy, especially to get vaccine for free. But apparently those who are living in Indonesia, yes, it's not only Indonesian and not only foreigners who does have legal documentation. We cannot neglect that refugees also stay with us in Indonesia. So we've seen the urgency of refugees also need to get vaccine because they're also having active interaction with Indonesians as their neighbors. And sadly, the government put refugees at the bottom of the list who can get vaccine. We can understand if the reason is about biological situation of a person that they cannot get vaccine. But clustering groups who can get vaccine based on their legal identity or status is risky because it's not only refugees themselves, the benefit is also for Indonesian, right? At the end, Indonesian people is the one who can get benefit from this vaccination. The further effort that the government can do is to make the system, and so to make the system to facilitate this refugee so they can get vaccine as soon as possible, same like the others who stay in Indonesia.
Of course, it's also in our best interest as a host country that the refugees whose living condition must be very close to one another get urgently vaccinated because we're living in the midst of a pandemic, as you mentioned. In other countries that are hosting refugees, for example, in Bangladesh, who is also hosting a lot of Rohingya refugees from Myanmar, vaccination for them is part of the nationwide vaccination program. Now, what do you think is the bottleneck for Indonesia in doing the same effort towards the refugees that we are hosting?
Yeah, as I mentioned earlier, it's about the system. We do encourage refugees as part of our governing system. Currently, they are only registered in UNHCR, as UNHCR is the UN body mandated by UN to help to tackle refugee issue in that respective country, same like as in Indonesia. But they are not registered in any of the government system. If you are aware, we are all identified as numbers. Our ID card number, our educational certificate numbers, our social net numbers, all these numbers. But refugees only having this identity number in UNHCR only. And our suggestion is instead of spending money to create numbers, so there are many actually talks within the government and also civil society and UNHCR that government wanted to create the new system. But our suggestion is instead of spending money to create numbers as the identification for them, for refugees, government can just use UNHCR number or the concept of UNHCR identification number to ease the work. So it's also benefiting to fasten the process that refugee can be identified and get vaccine as soon as possible. And we hope this is taken as the emergency step where UNHCR and government, along with civil society, who also working directly with refugees, to start organizing this and delivering the vaccine to refugee communities.
Right, and as you were saying, there is a bit of a problem with the system in terms of identifying the refugees, identification numbers. But as of now, as of to the knowledge of Suaka as well, what is the process going on right now for vaccinations for refugees and asylum seekers in Indonesia? When can we see them receive the vaccination, and hopefully soon?
Appreciate the local government who initiate the activity to give the vaccine to refugee community within their area. But sadly, the central government issuing the recommendation letter that stated the refugee cannot have their vaccine that should be cost by our national budget. Well, they already get the first vaccine, so it's just in the middle of their vaccine process, and this recommendation just interrupts the process. And based on the medical or science knowledge that the vaccine should be on the schedule, right? So we are actually regret this step, but hopefully, currently with again, the regional government, like you can see in Jakarta, where governor sending letter to the Ministry of Health, and also other cities, other provinces who initiate this activity. Hopefully, they can get this vaccine full on the second terms also. And yeah, we actually trying to get the picture of all the cities, that how can they manage to get the vaccine, because this vaccine activity should be engaged with the government, right? So we cannot provide it by ourselves. Right. It's only happened in certain cities, so not in all of the cities where refugees stay. So we appreciate and we want to encourage all the cities to do the same thing.
All right, Rizka, we wish you and Suaka the best of luck in providing help for the government to get these refugees their rights to get vaccinated. Thank you so much for joining us here on Asia Prime.